Health Watch is presented by UMass Memorial Health Care. Here, caring for you.
Welcome to Health Watch presented by UMass Memorial Health Care. I'm Brittany Schaefer. Today we take a tour of the eICU at UMass Memorial.
eICU is an electronic ICU. What it really is a telemedicine ICU that utilizes technology to help support our clinicians monitor patients throughout our community in our adult ICUs.
Who is part of the eICU team?
Our eICU is supported 24 hours a day, 7 days a week with an attending physician who is trained in intensive care medicine from multiple different specialties, and they are associated with an advanced practice provider, either a physician assistant or a nurse practitioner, and both of them are monitoring our adult ICU population continuously. And what they're trying to do is they're trying to discover patients who are in need of added help.
What is the mission of an eICU?
The eICU purpose is twofold. One, it leverages our workforce to help support our bedside clinicians. Not only are our bedside providers providing care to these patients directly, but we are continuing to support that team at the bedside to watch patients at a global level so that we can help identify patients who are deteriorating, and we can respond to those quicker and help support the bedside team during a patient crisis.
How common are eICU centers in the United States?
About 15% of non-government ICU beds in this country are monitored by a tele-ICU. There's two systems in the Massachusetts area that have a tele-ICU. Throughout the nation, every state has a tele-ICU system set up. Some support their local systems and some support at a more national level and across state borders. UMass Memorial Tele-ICU eICU program is currently monitoring our medical center here in Worcester, Massachusetts, but also helps monitor the Marlborough ICU, the Health Alliance ICU, as well as some of our community partners like Harrington, Milford, and Haywood hospitals.
How does an eICU benefit patients?
As individuals, we've all been either in the hospital system or have had a loved one in the hospital system. And one of the benefits to the eICU monitoring patients is that it gives almost a second set of eyes on a patient. It's supporting not only the bedside team, but it's monitoring patients to make sure that they are identified earlier if they really get into trouble. We're monitoring patients' vital signs, labs, diagnostic tests, and reviewing charts here in the eICU support center. And we have an advanced alert system that is pointing out patients who are getting sicker. So we can identify those patients early and help support that patient as well as the bedside team that's caring for that patient. The way that we do this is that we have a audiovisual system that is in all of our ICU monitored beds, and this camera can be turned on when and if it is needed, so that we can help see the patient and we can help provide support to the bedside team.